a result of cardiovascular diseases. Really is time to pay attention. My name is Chiko Kaitani, and of course, before we did have nutritionist Betty Okere as well as just answering some of your questions and telling us the do's and the don'ts. Now, when it comes to your lifestyle, how about making those changes? What are you actually eating? Well, Betty is here with me. Let's talk about fats.
I know. And I'm sure nobody will like me after this, but it's fine.
But it's important. It's important. Right. Okay, so when we talk about fats, we've had about unhealthy fats and we've had about good fats.
Yes.
Okay.
And I want to classify fats basically as saturated fats, unsaturated fats, and trans fats. So when I'm talking about saturated fats, I'm talking about fats that will basically originate from the animal proteins that we eat, and that is considered a not so healthy fat for the heart. Even though now in the last 5 years there's a lot of controversy surrounding how much saturated fat actually contributes to heart diseases and if we have sufficient evidence. Previously what has been there is observatory or observation researches, and we're getting to hear that that is not sufficient, but yes, it has a contribution to your heart problems. Now, in the background, what we should notice also is that all fats actually contribute to a little bit of all the other types of fats that I've mentioned. So if I come to unsaturated fats, then we have the monounsaturated fats and the polyunsaturated fats. What in layman's language we want to call the good fats, good for the heart, and they help to clear out the bad fat that might be in our bodies in form of LDL cholesterol. And lastly, we talk about trans fats. Now that has been proved to be the worst type of fat that your heart needs. And where do we get this? So most of us will look at, oh, I think I ate my fries and so I have trans fats. True, yes, but also just remember that when you have all this flaky, crispy, nice foods that we eat. You know, when you're looking at your pizza and it's very flaky and nice, you've frozen it, but it still looks fresh. That tells you that it has a lot of trans fats in it. We're looking at our baked goods, our pies, our biscuits. We don't really consider that. And basically a lot of our sugary treats also are high in trans fats.
Okay, so trans fats are actually what we need to look out for and what we're eating that contains those trans fats.
Yes.
So when we talk about these unhealthy fats that are actually contributing to our heart problems, we've got a couple of samples here for you. Look at that, kebabs.
Our deep fried foods, that's what I want to call them. I may not want to call the exact name, but our deep fried foods.
Pizza. Another culprit. We've got fries.
And that's the flaky. The more flaky it is, the higher the amount of trans fats in it. One thing also, and this originates from the American Food and Drug Authority recommendation, is that whenever food has got about less than 5 grams of trans fats, they don't indicate it, or they indicate as having 0 trans fats. Because they consider that a safe level. But how much of that 0.5, for example, or 1 gram or 2.5 grams of that trans fats are you eating? Because then if you're not sticking to a slice of pizza, for example, and you end up eating the whole pizza, that would be the 2.5 times the number of pieces that you've eaten. Eventually you still end up accumulating your trans fats, and that is not good.
Even something as simple as crisps, another culprit.
And that's in the deep frying. What they say about, there's a research I was looking at in terms of what really makes fat bad. Like you could have very good fat, let's say something like corn oil, and then you subject it to very high heat. Eventually it starts turning into trans fats. But also when we look at how people use their saturated fats, your hard fat, your lard, and everything else. You use it because it gives taste to food. It makes food really taste nice. You use it also because it is inexpensive to use, and so large commercials, restaurants, and
will tend to use
that. It is inexpensive. But also when you're using it in your baked goods, your cakes, your pies, it gives it longevity.
That's the thing I was going to ask you. Why, if they know that this is perhaps harming or harmful to our health, what is really the purpose of these fats in the food? So it's actually about giving it a better shelf life,
and that prevents it from going rancid. If you're going to use the healthy fats, the food is going to go bad very fast. And sometimes maybe we're just into the business and we're trying to, you know, sell as much as we can. And of course there's better flavor, all right? It gives it that nice taste and even the texture
Yeah.
when you use the bad fat, when you use the saturated and the trans fats.
Right.
Yes.
Okay. Savasa, so speaking about now the bad fats, we've talked about a few of the examples. Then the question is, what foods do we actually need to be sourcing for that are going to give us what we call a good fat? And we talked about this even before, by the way, before you even answer that there's this misconception about fats that people tend to have, number one.
And even cholesterol, you know, when people hear cholesterol and you're thinking of the plaque that you're going to have, you know, deposits on your blood vessels and how your heart is going to start to stop working, we forget that cholesterol is actually important in producing bile, right, which helps us to break down fat in our body, the digestion of fat. The same cholesterol is responsible for the production and maintenance of our sex hormones, the testosterone, the progesterone, estrogen, and that is good for us. It also is what makes the cell membrane. So we actually need it. Otherwise, if we do not have sufficient cholesterol, then even our brain cell membrane will not function properly. Yes. And what does that lead to? We have all these degenerative diseases. Right. But we just need it in good amounts. Yeah. And then again, fats are converted into fatty acids. Okay. All right? Okay. Of course, I know there's the part of you have excess calories which your body then stores, and much of it is stored as triglycerides. Yeah. But by eating fat, you do not necessarily need to be quote-unquote fat. Okay. Yeah? Okay. In fact, most of us are eating large carbs, and then we're ending up with weight, and we're blaming it on the fat. Okay. Yes. All right. So very quickly, let's go through our nice or good fats. Let me call it that. The nice stuff. Okay. It's just the moderation that really dictates. It's the moderation. Yes. Okay. So here we've got a couple of samples here in terms of sources. Let's talk about our nuts very quickly and how they actually contribute. So your nuts will give you the very good fats, the unsaturated fats. Macadamias are highly rated, and that would be very good. And the good thing with fats, whenever you have large amounts of fat, you can never overeat that food. Okay. You can't overeat it. Very nice. So macadamias will do a very good job. Cashews will also have your unsaturated fats, the polyunsaturated fats. Yeah. However, cashews are known to have high contents of carbohydrates. So again, you don't want to overdo them, and especially if you coat them with honey, that's even worse. All right. Your avocado. Avocado. Okay, 1 second, because I understand we've got a caller on the line. Yes, good morning.
Morning, how are you?
I'm fine, thank you. Yes, who am I speaking to?
My name is Mary Wanjogo from Ruiro.
Yes.
Mary have been suffering from H. pylori for all through. Nikikula chakula hii na niharibikia. Nikikula chakula hii na niharibikia. Yani acid inapada. Okay. Yeah, I would like to know what am I supposed to eat, or what am I supposed to be eating? Okay. Yeah. Okay, thank you so much for that. You can actually tell just from the sound of her voice that this is a challenge for her. She's really, you know, struggling. She's really struggling. Yeah, to understand in terms of what foods do I eat, and that's really a good question. Like, will I even be able to enjoy anything, Betty, at this rate if? She should be able to enjoy. Literally, if she has H. pylori, which is a bacterial infection in the GI system, then she should get that treated and treated very well. But even after the treatment, so of course there's a pylori kit which you get your proton pump inhibitors, what we call the omeprazoles, that will treat it. And then I would recommend that they get a dose of live bacteria, which they can get from the pharmacies or a prescription from their doctors. But how to avoid it next is to ensure that what causes it, they no longer eat it. And that would be, they're not going out to buy, you know, all these cut fruits and vegetables and they're eating it. They don't know the source. They don't know how clean it is. You know, just hygiene around the foods or the fruits and vegetables that we eat without cooking. Okay. Yeah. So yes, we were talking about now what we have here. So we've talked a little bit about the nuts, a good source. Avocado. And the avocado is also a very good source. Yeah. And people have vilified the avocado because they say, no, just eat a quarter slice of avocado. It has fat. It's going to make you big. I want to just say that is a myth. You know, if you eat a full avocado, for example, like that one, it's going to make you full, and that means you're not going to overindulge in your carbohydrates. Okay. And if you must eat your carbohydrates, then we're looking at, let us go for whole grains. Okay. Right? So you have so much fiber that can actually pull out that bad cholesterol out of your system. Nice. Remember, if you have bad cholesterol, which we call the LDL, then the good cholesterol diminishes. And if you have the good cholesterol, then it helps to sweep away the bad cholesterol from your system. All right. Okay. So very quickly, let's let's mention what else we have
here. So then we have
the
pumpkin, or I think sunflower seeds, we have chia seeds, and those are also good sources of fiber, good sources of oil, the polyunsaturated fats. And then we have margarine. So then if you're going to use margarine, then you're better off with the soft margarines as opposed to the hard margarines, because then the soft margarines do not have as much trans fats as the rest. But again, remember, how much are you eating? If you're going to eat excess, then it's going to be a problem.
All right, Betty, I'm going to stop you there for a second because we're going to get back to you in just a moment. But for now, we are going to be introducing to our set our other guest, who is Dr. Premanda Ponoth, who is the head of cardiothoracic surgery at Karen Hospital, who's here with us this morning. Welcome, Dr.
Thank you.
Okay, so we had a question here before concerning someone who actually has a pacemaker, or at least their loved one has a pacemaker, and they were asking, what precautions do I need to take in regards to that?
Once the pacemaker is inside and it is functioning well, they have to meet the doctor on a regular basis, maybe every 6 months or so, to make sure that it is working well. As you know, the life of the pacemaker battery, it's a lithium, it's approximately 10 years. There is a lot of research going on whether we can increase the longevity. In fact, there is thinking that whether we can do some nuclear energy to run it for a long time, but it is in the research. But by and large, I think every 10 years, it's just like your torch battery. You have to change it. So I think that longevity of a pacemaker battery is around 10 years. So every 10 years, it has to be, the battery has to be changed. So what they need basically is that they have to be checking with their doctor on a regular basis to make sure that things are moving well.
Okay, fantastic. You know, maybe we could actually just take you back a little bit as we're actually talking about common cardiovascular diseases. Dr. What do you think is killing us?
You know, if you talk about Kenya, 50% of my practice, or even more than that, 60 I would say, or 70, is rheumatic heart disease. You know, this is a disease that happens in the childhood because of the sore throat they have because of the infection by a bug called streptococcus. And if it is not properly dealt, over a period of time, it affects the valves of the heart. As you know, God has created such a way that we have 4 valves inside the heart, 2 on the left side, 2 on the right side. So these bugs, if you're not properly treated, they travel through the blood, come and get deposited on the valve, and they slowly start causing problem over a period of time. So what happens is that even though the disease happens when you are a small boy or girl, the disease manifests only the 2nd or 3rd decade. You understand what I mean? So that is why the school health program or the treatment of children with this sore throat and problems like that has to be very prompt, because if you don't take the proper care, they'll end up in trouble in the later stage of life.
Okay.
That's what.
Earlier on, we were actually discussing with Henry and with Betty about cardiovascular diseases. And question here that actually came in is, can this actually be spotted, or rather, when we talk about congenital heart disease rather, can it actually be spotted before birth, and what should a pregnant woman actually do in terms of preparing for this?
Usually in the organogenesis, the doctors say, when a child is inside the womb, the organs for the child develops in the first 3 months of pregnancy. And that is the time the mother has to be very careful in terms of taking medicine, avoiding infection. So whatever she does, she has to do with the guidance of the doctor. She should not do self-medication, she should not take drugs, smoking should be avoided, you know, all sort of things, so on and so forth. So if you take proper care, the child won't have any problem. Now, during the now the science and technology has advanced. Now we have very nice ultrasound machines by which they can even detect the problem inside the child when they are inside the womb at an early stage. And in fact, the research is going in such a way that they are planning to do, in fact, in America, a few places, they do surgery for the child inside the uterus. They would open the uterus, take out the child, do the surgery and put it back.
Their markets are so advanced.
That is called fetal heart surgery.
I've seen that actually,
So that is something which is being, being advanced. In few centers, they do it, not on a regular basis, but what they feel is that if you can treat it when the child is in the growing stage, the child comes out as a healthy child.
Oh, wow.
Rather than having a child with a problem and then tackling it later. You understand what I mean to say? So this is the way it is going. So we have fancy equipments, very good equipment by which they can detect it. And then, you know, sometimes when you do the amniotic fluid, when you do the analysis, that also can say whether the child has got any birth defects.
Okay, okay. Henry, just roping you in, and even Dr. you can weigh in on this. He's actually been talking to us about the AED and how this is a necessity in a lot of establishments and even at home, and even investing in this. The next question is, where am I even going to get this, by the way? And do I have to go through training, Henry, to be able to actually use that? Or is it just follow the instructions and be able to save a life?
Thank you. Sometimes you normally say it's good to get some training. So, and then after that, you need to familiarize yourself with the device. Because if you don't have a training, then that means you're not going actually to think about having this device as part of your rescue missions. So training is key first, so that you understand, by the way, if someone is having some cardiac arrest, I'll think of starting CPR, then think of activating emergency medical services, or where do we have this AED? So as soon as possible you have this AED, and as soon as possible you complete the chain of survival, which means they're going to be up to 90% of survival to those who are having some cardiac arrest issues. Yes. So it's an essential, and once you get the training, now it's just simple to follow simple instruction on what it says. Just simple as that.
Okay. Yes. From your practice, Dr. because we've been talking about lifestyle changes, when you're actually having your one-on-one with patients, are you seeing years of mistreating our own bodies that is now you're coming to pay the price now, and I come see you at your clinic?
Actually, now we are changing a transition in Kenya. It's like a changing the goalpost, you know. Previously I was talking about the rheumatic heart disease. Now I'm seeing more and more lifestyle disease like coronary artery disease because of the high cholesterol, fat. It is because probably there is an increase, you know, the prosperity of the people have changed. You know, gone are the days where the children play football outside. Now they are all on the computer. They are playing football inside the room. And, you know, so there's a change in lifestyle. You know, you remember your father or grandfather, they used to do, you know, walk and do all sort of things.
The shamba.
Now people go by car only. They don't want to walk or, you know. So inactivity, physical inactivity, change in lifestyle of the food. You start taking a lot of junk food, and, you know, as Betty has told, a lot of burgers and greasy food. Naturally, so there's a lifestyle alteration. And then stress, of course, is a very important part of the present day life. You know, you have it, I have it, he has it. So all of us have it. So previously it was much less, the stress was less. So stress, then as you know, blood pressure, hypertension, diabetes, all are on the rise. So multiple risk factors. You know, so blood pressure, diabetes, then smoking and drinking because of the stress.
Definitely contributing.
So it's like 2 + 2 is 4, 4 + 2 is 6, like that it goes. It's not one factor, it's multiple factors.
I think we said this, that it's actually a silent killer and you don't even know.
It is.
And so even as we're winding down, I understand we've got Faith on the line. Good morning, Faith.
Good morning to you, Chico.
Yes, thank you so much for calling in. Do you have a question or a comment?
Okay, I have a question. I have a problem on my chest side. Very sharp pains and sensation, and these pains have been there for some time. So I wanted to ask the doctor what could the problem be.
Thank you so much for that, Faith. Yes. And prolonged.
You know, a few things I wanted to ask you, Faith. Is it on the left side or right side? Number one. Number two, does the pain become more on exertion? You know, walking, climbing stairs. So number two. And then three, I wanted to ask her whether she has got any risk factors. You know, diabetes, hypertension, family history, stress, you know, all sort of things. So these are the things I wanted to ask, because chest pain is a vague term. It can be anywhere. It can be muscular pain. It may, because you fall down, you get pain. But, you know, if there is a prolonged chest pain, what Faith is having, I think it's better to get it checked.
And in fact, even as we're winding down, that's actually what I really wanted to ask you about, that signs I could really be having a heart problem and I'm not even aware of it. That being an obvious indicator, you know, running out of breath when you're trying to, when there's more exertion put. But what else can we actually look out for, in your opinion, Dr.
if you have a strong family history, for example, your father, mother, brother, sisters, close family has got heart problem, you are a potential candidate. So you should be on the watch out. Especially if you have a strong family history, you should be on a regular yearly checkup, even though you are healthy, just to make sure that things are fine. Because as you know, the studies have told that if you have a strong family history and you have the risk factors, the nidus or the seed for this problem starts even in the early childhood, in the first decade. That's what they say. So it is inside you. Only thing how you are going to nurture it. If you are careful, if you live your life in a more orderly way, the sign and symptoms will come much later. So think of a condition. If you smoke, drink, you don't care what happens to your life, the symptoms may come at the 40 years. That can be pushed to 60 years if you are careful. So you can, alter the whole system. So I think these are the people who have got a strong family history and stress and all sort of risk factors. They should be careful. And they should go for regular checkup. And they should, if there is a problem, prevention is better than cure. All
right. So speaking about checkups, can you share with us if there's anything even being planned at the Karen Hospital that people can actually plug into if they want to come for a checkup or any of the special clinics?
See, we are 24/7. We are there all the time. So we have a team. I'm happy to say that we have a resident team 24 hours. Not only the surgery, cardiologists, all the team members. We are there 24 hours. But our outpatient is from morning till evening. But anytime in the A&E, patient can walk in. There is team to check. That is one. Number two, we also have, as you know, 9 satellite centers throughout, all over Kenya. And there also we have regular cardiac clinics. Where which, suppose patient is in Nyeri, we can go to the Nyeri clinic and get checked. So we have a regular clinic there.
Amazing. Thank you so much for that. And of course, last but not least, Henry, the importance of actually investing in first aid and emergency response on a personal level. Why don't you tell us how we can also access that as we say goodbye?
Normally, I love to say life is why, and this is why we are doing this, and why we need to take care of our heart, why we need to take care of our brain also in terms of things. So it starts with basic knowledge, information, and also training is key, whereby we do have classes of training about basic life support, or basic first aid also that you normally train people on how to recognize, how to use such devices. So it's a weekly basis all over Kenya. You normally train from Monday to Friday. Come and learn and share so that you can always have a testimony of life is why.
All right, fantastic. Thank you so much, gentlemen. Even as they leave us with those points to actually think about, let me move over to this other side. My co-hosts are right here, and of course, Betty still at the center there. Gentlemen, good fat. This is the area we're looking at. Betty, as we're winding down, coconut oil, olive oil, and some of these seeds here. What do we have here as we're saying, Kwaheri?
And two things that I want to talk about, the egg and the cholesterol. So we've vilified the egg so much, it has cholesterol and all that. But now the guidelines are actually beginning to change. One egg is about 150 or 180 milligrams of cholesterol, and that's still sufficient. Now, one thing with cholesterol, if you have sufficient from your food, then your system does not absorb any excess. And it makes your liver not to overproduce it. And then for the fish, that is the good fats, omega-3 and omega-6. Just ensure that you have a balance, because omega-6, as much as it's good and it's from plant origins, also increases inflammation, which eventually might lead to a heart disease. So you need 3 and 6 balanced, because now the omega-3 stops the inflammation. You just need them in balance.
Believe it or not, salt is also another culprit that we need to highlight. Because watch your salt.
Salt is going to give you issues with your blood pressure. And you see, when you have issues with your blood pressure, your heart is going to be in trouble. Now, salt is salt. All right. So again, don't go out all exotic and trying to buy, red salt, blue salt, I don't know what other salt. Salt is salt. And if it's going to raise your blood pressure, it's going to raise your blood pressure anyhow.
All right, gentlemen, what's your take on matters of the heart this morning?
I just want to confirm again, because I love the way, coconut oil has got an amazing aroma. So you're saying that it's fine if I cook with it?
It is a saturated fat. There is so much controversy surrounding coconut oil. Just use it in moderation. Do not do it every time.
I think that's a key thing with oil.
all of this, because at the end of the day, it's all about moderation. And every time Betty comes, you just know, let your food be your medicine. Yes. That's where it starts. You know, if you get this right, less trips to the doctor.
Right.
So please,
as we eat this pizza,
pay attention. We say
a big goodbye. Not planned anything today.
He was just waiting for the pizza.
We can't waste it. We can't throw it.
Okay, guys, let's say a big thank you to Henry Akunda from St. John's Ambulance. He's actually a life support instructor, accredited, by the way, by the American Heart Association. A big thank you to Dr. Preman and Panoth, who is the head of cardiothoracic surgery at Karen Hospital, for stopping by. And thank you to you for all your questions and your comments concerning our heart health discussion.
Okay, fantastic. We're done. Up next, of course, in case you missed out Punchline yesterday, Isaac Ruto stopped by and spoke about everything from BBI to devolution, what happens next. And then after that, we get into the daily brief. You'll be back tomorrow, 6 in the morning. Bye-bye. Have a good one.
Bye-bye.